Hi, I'm Jim Gordon, co-host of the weekly television show Our City Tonight. I'm pleased to be back here with my colleagues from the Richmond Sentinel. Over the last 3 years, we've produced a number of video segments covering municipal elections and community news, and we're going to continue that because we think it's important to you, our citizens, as well as our readers and our viewers. Today, it's our big guest, Minister Adrian Dix. He is the Minister of Health and Francophone Affairs. Minister Dix was first elected as an MLA in Vancouver Kingsway in 2005 and re-elected in 2009, 2013, and 2017. Minister Adrian Dix, our guest next. We are now joined by Minister Adrian Dix. Sir, we know you're very busy. Thank you for joining us on this discussion with the Richmond Sentinel.
It's great to be on with the Richmond Sentinel. Thanks for all you do, Jim.
Thank you, sir. Hey, just for our viewers out there, to give a little context, we're recording this on the afternoon of Monday, April 26th. You have just literally come from your briefer with Dr. Bonnie Henry. One of the things you discussed, it was great to see, was kind of an in-depth breakdown on what people can expect in terms of vaccine amounts coming in May. Can you give a little more detail for some of our viewers that may have missed today's presser?
Well, our teams who are doing the vaccinations, and we get these reports from the vaccine centers all the time. I know you hear from people as well. They're doing just a great job. I mean, right now, we've delivered about 97% of the Pfizer we've received as we speak on April the 26th. And that means we're very hopeful that the Pfizer that we're expecting to come tomorrow arrives on time, because otherwise you'd have to delay clinics. Equally, the Moderna, which has been less consistent coming, we basically used all up. We've got a little bit more AstraZeneca, but that's out at 640 pharmacies largely, and that's going to be used up for the most part this week. So this week, the week we're in, the week of April the 26th, this week we expect to get 138,000 doses of Pfizer. Later in the week, at the end of the week, towards the weekend, we're going to get about 82,000 doses more of Moderna. That's this week's supply. And that's less than we expect to immunize this week. We expect to be, what we try and do is when we get the next round of vaccine, we like to have used up the last round. So it's going in people's arms, it's not waiting around. Next week, starting in May. So this week, 138,000 of Pfizer. Next week, and every week in May, we're going to receive double that of Pfizer, 276,000 doses in 4 weeks of Pfizer in May, or 1.1 million doses of Pfizer vaccine in the month of May. In addition to that, we expect to receive some Moderna, but how much, we don't know yet. Makes it a challenge to plan, but we don't know. We don't know if we're going to receive any more AstraZeneca or not, although there's some talk, and the federal government is trying to procure AstraZeneca. And then next week, at the end of the week, we expect to receive about 40,000 doses of the Janssen or the Johnson & Johnson vaccine, which is similar to the AstraZeneca. It has one advantage, which is that it's a single-dose vaccine.
Right.
So Dr. Henry talked a little bit about that today, using it with people in the community who we might have trouble getting to for a second dose. For example, those out working on forest fires in the summer, right? We may not be able to find them for the second dose. So that's a group of people we might be inclined to vaccinate with Johnson & Johnson, or people who are in the trucking industry or others, right? So that's what we're looking for in May. So we're going to get way more vaccine in the month of May than we've received in the month of April. But this last 2 weeks have been really slow. We have enormous capacity to deliver doses, and we got to keep that capacity in place, right? So we have to keep the ability to deliver massive amounts of vaccine in place, even if the federal government hasn't delivered it, because in May and June, we're going to need it.
Yeah. You've been on the front line of this challenge for well over a year. It's not really your part of what you're doing, you counting on the federal government. Are you happy? Are you somewhat happy as to what the supply has been like? Again, relying on the federal government to get the product here to the citizens of BC. Do you see the increase? That sounds great. Are we on track, do you think, to get the majority of BC citizens vaccinated at least once by late to mid-June?
Everyone by the end of June will have a chance for their first dose of vaccine, and we'll need to, of course, proceed. And we're starting to see that more in May, because there's some people who will have received it maybe the end of January, who didn't receive a second dose before we changed policies, who will now start to get second doses. So we're going to start to see second doses in May. But yeah, we're on track to do that. Am I happy? Would I like 1 million more doses of vaccine now today? You bet I would. And the country has got a large amount of vaccine, more than we did, more quickly. Countries such as the United Kingdom and the United States are countries that have a domestic production capacity of vaccine. Canada had that, and people will recall historically in polio vaccination and then with H1N1, that capacity really helped us. And this is something we have to ask ourselves as a country, I think, and the federal government does, because we had that capacity and we decided to rely on international suppliers. Well, this has been a tough year to rely on international suppliers. The United States is traditionally our great supplier of all things medical and pharmaceutical, our largest supplier, right? And they have interrupted that supply, whether it was personal protective equipment early on in the pandemic or vaccines now. They haven't really allowed any to go. The only vaccine that's come here from the United States is AstraZeneca, which they are using in the United States right now. So that's part of the reason why it came. So we have to, I think, I mean, surely if nothing else has been learned, and a lot has been learned, we have to have the federal government ensure that we have domestic supply and people. We cannot be in this situation. If we had a domestic capacity to produce vaccines, we'd all be better off. And I want to be clear, I'm not blaming the current federal government. I'm not getting into a political debate. This is something we as Canadians have to decide. We have to make things in our country. And vaccines is one of those things. Because I don't think this is either the last pandemic we're going to see or potentially the last time we need a vaccine for COVID-19.
Minister, you've just answered several questions that were going to be follow-up on what I just said. No one needs an armchair quarterback, especially in the media. We got enough of those. But yeah, that was my next comment, was that you can't blame the current government, but I think there should be some reflection when we get a little distance between ourselves and this one. And I'm in line with you on that this isn't going to be a one-off. We need to be ready next time. So I appreciate your comments on that.
I think it's important for us as a community, Jim, too, to reflect on the things we make and the things that we don't make.
Yeah.
Because often people say, well, it's too expensive to make that in Canada. It's cheaper to import it from somewhere. And it's cheaper to import it from somewhere unless and until that import is cut off and it's something essential. And I think this is something now all Canadians have learned it. And we don't learn this lesson as a country. I mean, I didn't agree with the decisions to get rid of the capacity back then, but we're in the middle of the pandemic. We shouldn't have that discussion now. But if we've gone through this and we don't create that domestic capacity here as a country, as a national mission in future, then we're not learning the right lessons from this.
And it's being on the front line too, it's amazing. You and I could have talked a week ago and there'd be different sets of questions we're continually adding to what we want to talk to you about. Just in the last week, we've had an airline freeze from some hotspots in South Asia, India, Pakistan. Has there been reaction from the communities here in the Lower Mainland about that? Tell us a bit about your feelings on that.
No, I talk, of course, I have many friends who are South Asian and many connections with the community. As you know, my wife, Renee Saklakar, was born in India. She came here when she was 6 months old, but she was born in India, in Pune, India, where, by the way, they manufacture the Serum Institute of India's vaccine, some of which we've received in British Columbia. So I had many contacts in the community. And I would say in general, the call to stop flights came from the South Asian community. So people understood better than everyone else the situation, the problem, and they were calling for that. So I think there's been support of it. That said, a lot of people in the community are affected by it. If you have family members currently in India for whatever reason who might need to get to Canada, obviously it's going to affect you, or if there's something that might take you there, that will affect you. But I think in general, most people that I've talked to, in fact, every person I've talked to in the South Asian community has been supportive of the decision to stop flights at the moment from India and from Pakistan under these circumstances. This final thing was said is, there's a tendency, what this also reminds us of is we're all in one big world, right? And there was a time in the pandemic when India, it appeared, was doing better than some other jurisdictions. And they had manufactured vaccines, something that, after all, we're not doing. We just discussed that, right? Mm-hmm. But the situation there is very serious, and to the extent that we can provide support and help and to people in India, we need to do that, because what we've learned, surely, from the pandemic is that what happens in one part of the world can affect people in other parts of the world. And so we need to, as best we can, ensure, yes, that everyone in BC gets vaccinated, but that access to that vaccination occur around the world so that other people are safe as well.
Just staying with the flights, and again, this is the federal government making this call, but you certainly would agree that optics are part of what has to happen and getting the optics right. With the flights, for example, a year and a half ago, I'm ecstatic when I find out Turkish Airlines is coming our way with a direct flight from Istanbul to here. We want to get back to traveling. I'm sure you do too. But is the timing really just not right for May 2nd to start these 3 times a week flights, especially when we have citizens, myself, yourself, saying, I can't go to Harrison Hot Springs, for example. Is this the right time? Is this something that should have maybe been delayed a little bit, do you think?
Well, I think I just say to everyone out there, this isn't the time to travel. It's not the time to travel internationally. And what the events in India and Pakistan show is that it's potentially, let's just call it problematic, for want of a better word, to be traveling internationally right now when one could be here and in line, ensuring you're vaccinated and keeping your family safe. This is not the time to be traveling. And it won't be the time to travel, I think, well, through the summer international. I mean, I think it may be possible inside BC and inside Canada to travel somewhat in the summer. But I think this is a summer to stay local. And I just don't think it's the time to travel internationally at all. And there's some people who have to do it for some reasons, either because of their business or other circumstances. But I think my personal advice to everyone listening is this summer, stay local, stay close, only travel within this country. That would be my advice to everybody.
Yeah, I would agree with you on that one, and it would certainly help out the local economy if you're staying local. Hey, let's talk about some of the positive stuff that I've seen recently in media, and we've kind of done a little sweep around some of Richmond. We went over to the River Rock, where one of the vaccination sites is. It's great to see, and I was on all of the news last night with the pop-up in Langley that most people are really, I don't want to say pleasantly surprised, but people are happy with the smoothness in which this is moving. Are you getting a good reaction from constituents on these pop-up ones that might come up? I know I had my shot because it came up and I was the right age. What's the reaction been for that? Because as I said, we've been seeing nothing but positive reviews on news and here in Richmond.
I think I think the experience of being vaccinated, the work done by the healthcare workers. We have people working from the hospitality industry as well, many of whom are from Richmond, because Richmond is in many ways our gateway to Canada and to the world with the airport. So they've been working on it and supporting it and using their expertise to support our vaccination clinics everywhere. I think the response has been really good. I mean, at a personal level, it's moving, I think, both for our workers and how well it's gone, at a logistical level and at a personal level. I think people have been doing a great job. And it is, for many people, also quite emotional. It's been a very difficult year for lots of people, and the opportunity to get vaccinated is important. And here's what I want to say to people in Richmond. Register. Register at the Get Vaccinated website. You'll be contacted as soon as it's your turn. You'll be contacted. In the main age-based, if you're clinically vulnerable, you'll be contacted. So register. What's true in Richmond, if I may say this, is that Richmond is slightly below the provincial average in terms of vaccination right now. Slightly below it. And we need more people. We need to get the word out that people register so we make sure that people in Richmond are safe. Richmond has done a very good job as a community in following public health orders and staying safe. But this is an opportunity for people to get vaccinated. And I encourage people, and I don't want to overstate it, right? We're talking about right now about 37% of people vaccinated across BC, and slightly less than that, 27, 28% in Richmond. That's partly because Richmond overall is a slightly younger community than some. So when you have an age-based system, you've got a younger community, then that has an impact. But that said, people in Richmond really need to get vaccinated and to register. And I really encourage everybody in your audience, if they haven't registered on the Get Vaccinated website, to register today.
Hey, just a couple more questions before we let you go, sir. I was seeing the numbers on one of your briefings with Dr. Bonnie Henry a few weeks ago in terms of what we were trying to avoid with indoor dining. The restaurants, we've had some fairly good weather lately, which has certainly helped the serving industry, the restaurants, bars, that kind of thing. Are you hopeful that things may, and again, you got to go by the numbers, come end of May, fingers crossed, hopeful that we're going to maybe see some changes, maybe small, but changes to people being able to dine indoors?
Well, I think the changes have been brought in through the May long weekend. And if you look at what we're doing a day, you think of there's 4.3 million people in BC. In the last week, we've been vaccinating about 40% of people, 40,000 people a day. So that's about 1%. Right. And so we're making progress. So today it's 36%, I think, almost exactly, of people vaccinating. Probably by the end of the week, because we haven't got as much supply this week, it'll be 40, 41, 42. And then going into May, we're going to be, by the May long weekend, we're going to be well over 50% of people who've had their first dose of immunization. And that's obviously, that will have an impact. So the changes we put in place to flatten the curve, to stop the spread, are also important. And I think what we need to do now is really bear down between now and the May long weekend. And if we can do that, then lots of things are possible. I don't want to say this is going to happen for sure, because what happens in public health is you assess the evidence every day. And so, but I do think that with the growing immunization and the effort over the next number of weeks, we can really have an impact by the May long weekend. At the end of that May long weekend, we'll be able to assess where we are, and hopefully we'll be in a much better place than we are now. If you look at the case counts today, they were in the 800 to 900, because today is Monday. We're talking on Monday, the 26th of April. The case counts were averaged over the weekend in between 800 and 900 cases a day. And our test positivity has come down, which means that the percentage of tests that are positive tests and our PCR testing has come down over the last 10 days. So these are good signs, but we're not there yet. These are a lot of cases. And we also have record amount of hospitalization, because people get really sick and get into hospital sometime after they get infected. So that's what's called a lag indicator. So we need to reduce our hospitalizations, the pressure on our ICU, and our case counts in the next few weeks. And if we follow the measures, we follow the guidance of public health, and everybody who's called to be vaccinated gets vaccinated, we're going to be in a better place by then. I don't know, I can't guarantee for sure a result, but I know we're going to be in a better place.
Yeah, it certainly wouldn't ask you to. It's all numbers, and we don't know where we'll be. As I said, a month ago, looked like we were relaxing a little bit, and then we had to change things. So one of the things you announced today, too, also, was for our viewers out there who may have kids or even grandkids, we're talking about this 18 years and up. They can start registering now, correct?
That's right. Everybody can register. Everyone 18 and above can register. More than 100,000 people between 19 and 24 have registered. So it's good news. And I think that people, sometimes in those age categories, people are, in fact, more suited to registering on the internet. I don't know, than maybe people of my generation. So we have quite a few people registered, but it's important that everyone get registered for a couple of reasons. One, when we target, because we're doing some of our effort at targeting particular neighborhoods that have high rates of transmission. So if we're targeting your neighborhood, you'll want to be registered, so you potentially can take advantage of it. But mostly, like this evening, Monday night, we're going to move to people 59. So everyone born in 1962, tonight will get an email or text message from us saying you can register. You can book you can book your vaccination. And later this week, I think Wednesday, it'll be 58. So if you're registered, you're told immediately that it's open for booking, and you book, and you can get your vaccination right away. And that's why it's so important to register, particularly if you live in Richmond, because we want to see Richmond as high as everybody else in terms of vaccination.
Well, I appreciate your time, Adrian Dix, of course, the Minister of Health and Franco Affairs. I know you're busy, but I do appreciate the fact that you were there when the media calls on you. I noticed a couple weeks ago, I think you were the only minister that was on question period on a Sunday out of all the provinces. So I appreciate you taking time to talk to the viewers, the readers of the Richmond Sentinel, and the citizens of Richmond. We wish you best of luck going forward, sir, and thank you for the time.
Dave, thank you, and thank you for all you do at the Sentinel. And it's important that we keep working together. This is it's a challenging time for lots of people, and I so appreciate so much support we've received from people in Richmond from the beginning of the pandemic. And thank you for all the work you're doing as well.
Thank you, Minister. Best of luck going forward.
Right on. Take care.
Thank you. Cheers. Again, our thanks to Minister Adrian Dix. And thank you for watching. If you have any comments, make sure you reach out to us. It's richmondsentinel.ca. We'd love to hear from you. Thanks to the team here, too, at the Richmond Sentinel offices. I'm Jim Gordon. We'll see you again.